Morning, guys. How are y'all?
How are you?
I'm doing okay. It's Tuesday, so we're making progress. We're almost halfway through my part of the course, so we're doing good, I think, so far. Yesterday we finished up the section on orthopedics, and now we're going to start abdominal radiology. Your quiz. What day is your quiz? Is it next Monday?
It's Monday.
Awesome. Okay. So on your quiz coming up, the subjects that will be on it will be neuro radiology, orthopedic radiology, and this abdominal radiology. We should be able to finish this up pretty easily, probably by Thursday. And if we finish this up by Thursday, what we'll probably do is give you guys a walk on Friday. We won't have class, and I'll give you a little bit of time back so you can start studying for your quiz on Monday. How's that sound?
Perfect. Thank you. I do have a question.
Yep.
Um, in the schedule, it says that we'll have the exam or quiz on Monday at 8 a.m. and then that we have class after at 10. Is that correct? Or is it just a test on at 8?
We will probably just have the test because then the second exam, is that also on the following Monday?
Yes.
Yeah, so that still gives us, then if we don't have class after the exam on Monday, that still gives us 4 days to finish up what we got to finish up, which should be enough time.
Okay, perfect. And so if we don't have class, is there any chance that we can take the test at 10 and not at 8?
I could care less when you take the test. That's going to be up to probably Charlie,
Yeah.
because he's the one that gets it administered and proctored. I write it, and then I have no idea how to set it up, schedule it, and all that. So, in fact, I just emailed him earlier today and said the exam is almost ready to go, and so he will set it up. So I would get with him on exactly the timing of that.
Perfect. Okay, I can ask him. Thank you so much.
All right, no problem. So let's go ahead. Any other questions before I hurry along with the start of abdomen? Any other thing, concerns? Everybody still enjoying the class as much as you can? I know it'd be better to be sitting at a bar, but it's not. So okay, so let's continue on. We're going to talk about abdominal radiology as we move forward. So the first thing that when I was in your shoes, when I was in radiology, taking radiology, and just to let you know, when I took radiology in vet school, the class of radiology at A&M, I got a B in it, and it pissed me off. Okay, to this day, I think I ended up with like an 89 all the way through undergraduate and most of vet school. It seemed like I was the king of getting 88s, 89s, 78s, 79s. I was 1 point away from a whole new grade point, level, but I was the king of always getting 1 point away, it seemed like. But yeah, I got a B in radiology and it still pisses me off. So anyway, the first thing that we had to do was, this is back in the old days. We didn't have PowerPoint, we didn't have computers, and we had paper and pencils and lots of notes in big notebooks. And we had to get out a piece of paper, and in a lateral projection and a VD view, we had to draw where we thought these organs would live and their relation to each other. So, basically, what's the liver going to be shaped like? Where's it going to be located? Where is it located in respect to the kidneys and spleen and everything on here? So this is a list of the majority of the organs in the body that I'm not going to make you draw them on a piece of paper, but that's the first thing is you have to figure out radiographically where they live. It's much different than looking at gross anatomy. It's a lot different than opening up a dog in surgery and looking and saying, there's the liver and here's where it's shaped. With radiographs, of course, everything's on top of each other, everything's summited each other on two different views, and you have to know what they appear to be like on radiographs. And the same thing really holds true for ultrasound too, but that's coming up. So anyway, so bottom line is you have to start learning where these organs live, what they're normally shaped like, and where they are with respect to each other. And that's what we're going to spend some time doing. First off, why would you need to get abdominal radiographs of animals? There's lots of different reasons. One of them, and one of the more common ones you're going to see, is the animals present and they either are vomiting or they have diarrhea. and you kind of wonder why. And so you radiograph the abdomen to see if you can figure out why they are vomiting and why they have diarrhea. The second one kind of goes along with the vomiting dog. Did he eat something funny? Is there a foreign object in there that's causing a mechanical obstruction or partial obstruction that's contributing to vomiting or diarrhea? Another one, abnormalities when urinating or defecating, peeing all the time, defecating all the time, or they can't urinate or they're having difficulty defecating. That would be another reason that one might want to shoot abdominal films. Again, abnormal abdominal palpation. So you palpate the abdomen in this middle-aged older dog and you think you feel a mass. There might be a mass in there, and so you're unsure. And so radiographs might be able to help you to make that either one way or the other, more clear or not. A sudden increase or decrease in size of the abdomen. The owner comes in and says, "Hey, yesterday my dog was fine, was running around happy, everything, but I woke up this morning and his abdomen looks like it's twice the size as it was yesterday." That also, again, would be a good reason to get some abdominal films. The next one would be abdominal pain. Obviously we can't feel their pain, but most of the time in the dogs and cats, the owners will be able to perceive, they seem like I pick them up, they have abdominal pain. And that would be another good reason why you might want to get it. So abdominal films are not hard to get, nothing really tricky about it. You always, again, rule number one with radiology is always get two views, and they should be at 90 degrees to each other, or otherwise known as orthogonal views. And so you always want to get a lateral view and a VD view. Sometimes you'll want to get the opposite lateral view as well, and we're going to talk about why that is coming up. With thoracic films, you want to typically try to get the thoracic films at full inspiration. So that's, and I'm sure Dr. Warner went through that with you. But when if you were to go into a local human hospital and you need to get thoracic films, the first thing the tech's going to do is tell you, take a deep breath and hold it. And we would love to do that with animals with thoracic films too. We want them at full inspiration because that fills the lung up maximally with air and makes the thoracic films much prettier. And you can see small things in the lung better than if the lungs weren't full of air. So in animals, we can tell them till they're blue in the face, take a deep breath and hold it, but that's not going to happen. And so with thoracic films in animals, you watch the dog breathe and try to expose the thoracic films when they're inspiratory. Okay. The abdomen is kind of the opposite. You want to expose the abdominal films at expiration. So you don't want to just randomly shoot the abdominal films or the thoracic films. You want to try to do it at a different phase of respiration. The reason why we want to do abdominal films in expiration is when they are expiratory, the abdomen is usually thinner, especially in lateral projection, than it is when they're taking a big deep breath. And the thinner the abdomen, the thinner body part that we're trying to radiograph, it makes the images prettier because we have less scatter radiation. You always want to get the entire abdomen on the film. And this sounds stupid, but it's not. And I see this all the freaking time from radiographs that veterinarians send me. Let's say you have a Labrador and he's a big dog and his whole abdomen doesn't fit on one film. Okay. So you shoot one lateral view of the abdomen, and invariably you will cut off a portion of the abdomen. So you may cut off the cranial abdomen, the caudal abdomen, but you don't want to shoot abdominal films and not be able to see the entire abdomen. So some of those big dogs will require you to shoot two lateral views and two VD views, one kind of cranially located, one kind of caudally located, so that you can see the entire abdomen. Very commonly, I will get abdominal films, read one already this morning, abdominal films for veterinarians, and the history is vomiting, don't know why he's vomiting, and you can't even see half the stomach on the film. Okay, might be a good idea if a dog is vomiting to make sure it include the entire stomach in the region of the film. Okay, but that happens way too often. Again, sometimes you need to get the opposite lateral view, not just one lateral view, and we're going to talk about that. And then not uncommonly with abdominal films, if we're trying to answer one of those questions we just talked about, why is the dog vomiting? Why does he have diarrhea? Do I see a mass definitively on the radiographs or not? Sometimes you just can't decide. Radiographs are not perfect. And you know, based on your experience looking at those films or whatever, and even us radiologists, a lot of times the answer is not definitive. It's, I think you might have a mass, but I'm not 100% sure. And in those cases, you either have to repeat the films at a later time and see if whatever it is that you're worried about is persistent, or you have to do other procedures like an ultrasound. Okay, so first off, and I'm sure you've already learned this a little bit, but there's this thing called hanging protocol. And that the name comes from when you would actually, back in the old days, when film was film, and you would hold the film in your hand and you would stick it up on a light box or a view box, hang it on the clips, and you always wanted to orient the films in a specific direction. Okay, so in veterinary medicine, the hanging protocol is different than in human medicine. In veterinary medicine, every lateral view that you take, whether it's a lateral view of the abdomen, the thorax, the pelvis, a stifle joint, the skull, or a hock, you always want to put head to the left. And so a lateral view always hang with the animal's cranial aspect to the left and the caudal butt end of the dog or the cat to the right. So it doesn't matter if it's a left lateral view or a right lateral view, you always hang lateral views with the head to the left. You never face the head the opposite way. Okay. The VD view is like a mirror image. Okay. A VD view is like you're looking at the mirror. So the dog's right is over here. The dog's left is over here. So every VD view, whether it's of the skull, thorax, abdomen, pelvis, whatever it is, you always hang it, you know, upright like that as a mirror image. In human medicine, because I think we all walk upright instead of on all fours, they look at lateral views also vertical. So in human medicine, both of them are looked at vertically instead of the lateral views, and animals are always head to the left. Okay, again, just a quick review before we haul off and start with the abdomen. Here's the 5 basic radio opacities that you can see on radiographs. Hopefully this is hammered into your heads now and you already know all this stuff. The most opaque opacity, and these are in order of most opaque to least opaque. The most opaque is metal. Well, where's our metal? Well, we see metal around this arm. Okay, that's metal, it's bright white. Okay, the next opacity that's kind of white is mineral or bone. And so we see here's vertebral bodies, there's lateral spinous processes, here's some ribs. It's not as quite as bright white as the metal, but it's brighter than the soft tissues. The next opacity right in the middle is soft tissue, otherwise water. Okay, so here's the urinary bladder. That's an opacity. It's not as bright as a bone, but it's brighter than the adjacent fat. The next 4th opacity that is going down the row of radio opacities is fat. So here's about a falciform fat here. This is liver, and we can tell the difference because the liver has a different opacity than fat does. Okay, we can see the edge of the urinary bladder here because the urinary bladder has a soft tissue opacity, and right next to it is a fat opacity. Because they're different, that's why we can see the edges between them, the margins. Okay, and then the last or most darkest opacity is air. So where do we see air? Okay, well, there's gas in the colon, there's gas in the colon, a little bit of gas in the small bowel, gas in the stomach, gas in the lungs, and lots of gas around the animal. Okay, so that's our 5th opacity. Okay, again, we'll review the summation sign. Here I have the summation sign. If you remember, it's 2 structures that part of them superimpose, and one structure is over the top of the other structure. And where they superimpose, it's a little bit more opaque. You don't want to mistake that as a mass lesion or an abnormality. That's the summation sign. So here's one kidney sitting in here. Here's another kidney sitting in here. And where those 2 kidneys overlap, that's a summation sign. They summate, they're on top of each other. And you can see that area where they overlap is a little bit more opaque than the rest of the kidneys. Okay, summation sign. That's different than a silhouette sign. And a silhouette sign is when now you have 2 structures that are sitting right by each other, right next to each other, and they are touching, and they have the same radiographic opacity. Then you can't tell the margins between them. So right now I have an enlarged liver. The liver is in here somewhere, but I cannot see the margins because in the abdomen, now I have a lot of fluid in the abdomen, which isn't normal. And the fluid opacity silhouettes with the liver, which is also fluid or soft tissue opacity. They silhouette together, and therefore I cannot see the margins between the 2. That's the silhouette sign. Okay, so how do you position a dog? You sit him here, lateral view, not hard, and the VD view, nice and straight lateral on the VD view, and you shoot your X-rays in those orientations. So here is a lateral view of a normal appearing dog. Looks like the dog needs to probably go out for a walk and maybe get rid of all this feces in the colon. But let's go through anatomy wise and show you where the organs live. And now you have to realize that some of the organs that let me go back to this list here. Some of these organs you can see on radiographs in every dog. Some of these organs in every dog you can't see. We have to know where they live in case they become abnormal and too big. And then you might be able to see them, but some of these organs you can't definitively see on plain films, but we still have to know they're there and where they live. So of this big list, you can see the liver, you can see the spleen, the gallbladder you can't see. Okay. And why is that? Well, normally the gallbladder, what is the gallbladder normally full of? Is it full of fluid opacity, gas opacity, or metallic opacity? Which one? Fluid. Yeah, there's bile, which is a fluid opacity. So normally the gallbladder is full of fluid. Well, what's the gallbladder wall made out of? Metal, bone, or fluid opacity? Fluid opacity. And then the gallbladder is surrounded by the liver, which is what opacity?
Fluid opacity.
So if we have a fluid opacity liver surrounding the gallbladder wall, which is fluid opacity, with fluid inside the gallbladder, guess what they're all going to do together?
Same.
They silhouette. And therefore you can't see the margins of the gallbladder. And that's why you can't see a normal gallbladder on plain films. Okay. The stomach you usually see because stomach traditionally will have a little bit of fluid in it, but it also has gas in it. And a lot of times it'll have a little bit of food in it. And therefore you can see things. The small intestine, typically you will see winding around the abdomen. The duodenum is part of the small bowel. You know where it lives, and typically a lot of times we'll see where the duodenum lives. The cecum in a dog is a big, distinct gas-filled structure. In almost all dogs, you'll see the cecum and it'll have gas in it. And we'll describe that here coming up. The cecum in a cat is different. The cecum in a cat is so little, it's almost non-existent, and you'll never see a cecum in a cat. Okay. Falciform fat is the fat that I just pointed to on one of the slides. It's ventral to the liver, and you can see the falciform fat. The kidneys, on most every dog, you can see the kidneys. You know where they live. There's one on the right side, there's one on the left side, and you can definitely see the kidneys in a normal dog. The adrenal glands, on the other hand, you will probably never see in a normal dog. You can find them with ultrasound, but radiographically, normal adrenal glands you're not going to see. There's too much stuff around them that's kind of in the way, and the adrenal glands are very small, and you're not going to see adrenal glands on normal dogs on normal plain films. The urinary bladder you can see. The prostate in a dog, if they become big, dogs that have benign prostatic hypertrophy or abnormalities of the prostate, you can typically see prostates. The ovaries in intact female dogs and the uterus, most of the time you will not see. Okay. The pancreas, you probably will never see on plain films unless it becomes really large and abnormal. And then you'll see signs of like pancreatitis. The colon in all dogs you're going to see, it'll have gas and feces. And then we also have to know that there are a few groups of lymph nodes that live in the abdomen. Most of the time, if the dogs are well fed, well, parasite free, and they're in good physical shape, you're not going to see lymph nodes in the abdomen on radiographs. On the other hand, if the dog has lymphoma or other conditions that cause those lymph nodes to become too big, then yes, you will see them. Okay, so not every organ you can see on plain films. The majority of them you can, but typically the little ones you really don't see. Okay, going back to this slide here. So where does all this stuff live? So real quickly, we're going to go through this and then we're going to talk more specifically about things. So going from left to right, like you're going to read a book. So here's the diaphragm. So that's the diaphragmatic margin. Up here's the thorax, and there's some lungs right in there. Okay, so if I look at the diaphragm in the abdomen, this organ that sits right here, that's the liver. Okay, and the liver is well defined. And the reason why you can see the edges is because next to the liver is another opacity that is not the same as the liver. We have fat here, we have fat here, and over here we have air in the lung. And so this area right in here is the liver. Okay. This thing right in here is the stomach. Okay. The stomach in this particular case has gas in it and it has a bunch of food in it. So it probably has dog food in it or treats from the cat litter box or whatever is in there. It has food inside the stomach. Okay. The stomach, depending on when the dog last ate, it can be really big if they just chowed down, or it can be very small with just a little gas if they haven't eaten in a while. Okay. This organ sitting right down in here on the lateral view, we're seeing a part of the spleen. Okay, that's the kind of this little triangular fusiform shaped organ right in here. That's the spleen. And again, we can see the margins really well because right next to the spleen, we have fat in the mesenteric region. And because we have one opacity that's different sitting next to another opacity that's different, now we can see the edges. We'll talk about in a second, the rest of the spleen kind of goes up this way, but we got all this other stuff in the way, and so you really don't see it. This part you'll usually always see in a dog. Sometimes you don't see this part in a cat. Okay. And then we have this organ back in here. So this organ here is pretty small in this particular dog. That's the urinary bladder. Okay. The urinary bladder is going to be variable in size. If the dog needs to pee or the cat needs to pee really bad, it's going to be pretty big. Okay. If they just peed, you're going to be hard pressed to even find the bladder because there's nothing in it. Okay. This structure right in here, this is feces in the colon. So there's feces, a big old fecal ball there, another one there, and this is a little gas around it in the colon. So all of this area right in here coming up through here is all colon. Okay. And then this little gas opacity that always sits kind of dorsal in the mid abdomen in a dog, that's the cecum. It's big and almost always gas filled. Okay. On the lateral view, the small bowel is all of these other loops that we can see kind of scattered all through here, randomly situated. There's a bowel loop here, there's a bowel loop here. Some of them have fluid in them, some have gas in them, some have a combination of gas and fluid in them. Okay. And then the kidneys kind of sit up in here. And this dog has a lot of feces in the colon. So it's really difficult to define exactly where the kidneys live. But we're going to look on the VD view, the orthogonal view, and see if we can't find the kidneys on the other view. And of course, up here is the lumbar spine and the intervertebral disc spaces in the pelvis. The other thing to note in this dog is his detail is very good. His what's called the surface serosal detail. So that means the outside margins of these organs is called the serosa, and I can see the edges really well. Again, they pass the Sharpie test. If I asked one of you to go trace the edge of the liver or the edge of the spleen, you could do it with high accuracy because the detail is good. If the animal had a bunch of fluid in the peritoneal space, then that fluid would silhouette with the liver, and then I would have a lack of detail because I wouldn't be able to trace the edges of those organs. Okay, on the VD view, let's kind of review. So on the VD view, this area right in here, here's the diaphragm, and this area right underneath the diaphragm is the liver. So it kind of is sitting right in here. Most dogs will have a little more liver on the right side than they do on the left side. So this is liver. Right, caudal to the liver, same as on the lateral view, is the stomach. So the stomach lives caudal to the liver. So this is dog food in the stomach. Stomach has a moderate amount of dog food in it. That's the fundic region of the stomach. The other part of the stomach comes over here. All of this is stomach right in here. Radiographically, the stomach has two parts. It has a fundus, which is the bigger part, always on the left side. And it has the pylorus, which is over here. It's the smaller part. A lot of times the pylorus have a little gas in it. So there's gas in the pylorus. So all of this area right in here is where the stomach lives. Okay. Then we talked about the spleen. Well, on the VD view, the spleen is this little triangle guy. Okay, the VD view shows the spleen in dogs and cats over here on the left side of the abdomen, and it usually shows up as this little triangle. Okay, the rest of the spleen, again, you can't see, but it kind of travels over this way, all through here, but you don't see it because you got too much stuff in the way. Okay. And then if we go down, here's the left kidney right in here. That's part of the left kidney. The right kidney is going to live a little more cranially, so up in here, but I don't really see it well because, again, I've got all this other stuff that's on top of it, too much stuff in the way and somates with it. Okay. The descending colon is right in here, this area here. It's got a lot of feces. The descending colon most of the time goes down the left side of the abdomen over here. The transverse colon, which you can't see very well, comes over here. And then this is the cecum with a little bit of feces, this little gas-filled thing. So the cecum typically lives here. You'll have a little short ascending colon, the transverse colon, and the descending colon. And all of these other lazy loops that contain fluid and gas throughout the remainder of the abdomen, lying everywhere throughout here, are small bowel loops. Okay. In a cat, it's the same damn thing. So just to review, in a cat, here's our liver. The liver looks normal in size and shape. Here's the stomach. This cat's stomach has just a little bit of gas in it. Okay. Here's the colon. It's got gas in it, got a little feces here. So this is all colon right through here. Okay. In a cat, I said you hardly ever see the spleen on the lateral view down here, but guess what? In cats, a lot of times you'll see a little part of the spleen up here. That little thing right in there is the cat spleen. Okay. And then on cats, here's the kidneys. There's one kidney here. There's one kidney here. Okay. And here's the urinary bladder that contains fluid. We got a bunch of randomly oriented small bowel loops throughout the remainder of the abdomen that contain combination of gas and fluid, maybe a little bit of ingesta traveling through the small bowel. Okay. Now, of these two kidneys, can you tell on the lateral view which is which? And most of the time you can, because we know the right kidney is usually going to be more cranially positioned than the left kidney. Okay. So if I see two kidneys here, here's one here, here's another one back here, I can bet you money that this one is going to be the right kidney. Okay. On the VD view, what do we see? Again, liver here, same as a dog. Liver sitting up in here. Here's the stomach. That's the fundic region of the stomach. This is the pyloric region of the stomach coming over here on the right side. Here's part of the spleen that we can see is kind of ill-defined, but there's the spleen sitting right in here. Here's the left kidney. Okay. The right kidney you can barely make out is probably right through here. We've got a lot of stuff in the way. Okay. And then the colon is sitting right through here, kind of in that area, and all the rest of this is small bowel. Okay, fat cat. Fat is radiographically, fat is your friend in the abdomen. Okay, because the more fat they have, the better the detail is going to be, because then the fat surrounds all of these other organs that have gas and fluid in them, and you see better detail of the edges of the abdominal organs. So this is just a fat animal. Everything else is the same. Urinary bladder in this case is moderately distended. Does that mean anything? I don't know. Maybe the cat just has to pee. I don't know. Could it be obstructed? Yeah, it could be. A bunch of feces in the colon that we can see in here. Okay, so fat cat. Now I can see the kidneys really well because there's a bunch of fat in the retroperitoneal space surrounding the kidneys, and I can see the margins of the kidneys very well. Okay, fat cat VD view. Kidney here, I can see part of it. This part up here I don't see as well. Okay, so as we go through, again, we're going to talk, let's revisit this concept of surface serosal detail. Okay, again, we said that in a normal dog, that is an adult dog or a normal cat, we want to be able to see the edges or the margins of the abdominal organs, and they should be relatively well defined. And again, these all pass the Sharpie test. I can see the edge of the spleen. I can see the edge of the liver. I can see the edge of the stomach wall. That's the edge of the stomach wall. I can see the outside edge of the small bowel loops. There's the outside edge of the small bowel loops. Okay. I can see the outside edge of the colonic wall right through here. Okay. I can see a little bit the edges of the urinary bladder. So overall, I can see margins, I can see edges, and that's normal. This animal, you would say, has very good normal surface serosal detail. That's what you like to see. Okay. On the other hand, this animal here, his detail's not as good. Okay. I can still see the edges of the spleen, but they're not as well defined. I can still see the edges of the liver, but they're not very well defined. Everything through here, I don't really see the edges of the small bowel here, the outside margins. I don't see the outside margins of the colon like I did before, or the urinary bladder. So I think everybody would agree the detail in this abdomen is a lot different than the detail in that abdomen. Okay. And why is that? Okay. You need to know, and you will be asked coming up, are what are reasons why you have a lack of surface serosal detail in the abdomen? Well, there's two or three things that can cause a lack of detail. In this particular case, this animal is super thin. Okay. He doesn't have much fat. For whatever reason, he's emaciated. He may be starving. He may be a really thin body condition type of dog. Okay. Or he may be really young. Most young puppies don't have, and kittens don't have much fat yet. And so they have lack of fat in their abdomen. Anything that will cause a lack of fat in the abdomen will decrease surface serosal detail. So he's very thin, and you get a little bit of a hint of that if you look at the shape of the ventral abdominal wall. And this one's it's flat or almost concave in appearance. The last dog we looked at, it's almost kind of pendulous in appearance. It's moving out instead of moving inward. Okay, so that kind of gives you a hint. This dog is relatively thin in body stature, and that lack of fat in the abdomen will lead to a lack of surface serosal detail in an emaciated dog. Okay, so here's the comparison of the two. So this dog has good detail, this dog has poor detail, and it's probably due to the lack of fat and thin body condition or emaciation. Okay, so we just learned that the lack of fat can lead to a cause of poor surface serosal detail. And typically, the lack of fat can be due to an emaciated animal, or it can be due to we just have a young animal that doesn't have fat yet. Okay, there's another reason why we can have a lack of detail, and we talked about it when we talked about this animal right here, is the presence of peritoneal fluid. Normally, how much peritoneal fluid should be in the peritoneal space in a normal dog or cat? And the answer is always just a few drops. Okay, an extremely small amount that is in there just to keep the organs, slippery and not rubbing on each other. Okay, but you shouldn't have any more than that. If you have more than a few drops of peritoneal fluid, that's abnormal, and you have to try to figure out why it's there. Okay, so we know that a lack of detail due to peritoneal fluid will cause this. So now I have this animal here. I see the edge of his liver, but I can't see the edge of much anything else. Okay, this abdomen has a pendulous appearance because now there's a bunch of fluid in the peritoneal space. This animal also has a lack of detail, but he has a tucked up appearance, kind of a concave appearance, and he has a lack of fat. Both of those conditions, however, will cause a lack of surface serosal detail. Does that all make sense? Okay, this is a puppy abdomen. Now, how do you know by looking at that this is a puppy? Okay, number one, his detail isn't very good. I don't see the edge of his liver or stomach or anything. It's not really good. It's got a bunch of gas and dog food in here, but I don't see the edges very well. And that's because he's a puppy and he doesn't have any fat yet. So a juvenile abdomen. Okay, how do you know he's a puppy? Well, if you look at the vertebrae, he's got open growth plates on the end plates of all of the vertebral bodies. Got open growth plates down in his pelvis. Okay, so that tells you he's really, really young. Okay, the opposite can be true too, where you have increased surface serosal detail, even more than you would like to see. And they're usually the reason why you would have that is if you have free air in the abdomen. Okay, so this animal had recent surgery. He's got a bunch of staples along the ventral abdominal wall. He's got a bunch of hemoclips in here where they clamped off blood vessels in the abdomen. Okay, but anytime you go do a surgery on an animal, whether you're going to spay them, or in this case, they did a splenectomy and took out the spleen, by the time you sew the animal up, there is always going to be some air, room air, that's left in the peritoneal space. And the presence of air in the abdomen will cause a improvement of detail because now we don't even have fat next to these soft tissue abdominal organs. We have air in there. Okay, so we can see here's the stomach right in here, and this edge of the stomach is really super well defined because we have all this free air in the peritoneal space, and here's air dissecting between the liver and the diaphragm. Okay, so we can see that air, these little gas bubbles throughout the abdomen, will actually improve surface serosal detail to the point where it's abnormally good. Okay, so free air in the abdomen after surgery is really common. Typically, when you're going to sew the dog up, you should before you sew it up, you should kind of squeeze the abdomen, try to get as much air out as you can, but there's always going to be some left. Okay. So Another reason why you can have, why you can have free air in the abdomen is, and we're going to talk about that, is the air, where does it come from? Well, it has to come, if you have free air in the peritoneal space, it has to come basically from the inside of the dog or from the outside of the dog. In this case, it came from the outside of the dog because you surgically opened up the abdomen. Okay. What's another reason that can introduce air into the peritoneal space from the outside, that arises from the outside of the dog? You think of some other condition that could introduce abnormal air into the peritoneal space. And yeah, a gunshot injury, that would be a really good one. Okay. Or a bow and arrow injury. Okay. So somebody shot the dog with an arrow, and that can introduce free air. Okay. So again, those are two common things that would introduce air from the outside into the peritoneal space. What is a reason why you could have air coming from the inside of the dog and lead into air in the peritoneal space? Okay, the big one there is a ruptured bowel viscus. So you have a hole from an ulcer or trauma or perforation from the stomach wall or the small bowel or the colon. Okay, and that allows air to go in the peritoneal space. That's a big deal. If you have free air in the peritoneal space and the dog has no evidence of recent surgical intervention, or he hasn't been recently shot by an arrow or a gun, that usually is an emergency surgical situation. That means you need to go in right away because he has perforated something in his bowel. Okay. And that is an emergency situation. All right. So free air in the peritoneal space, and we'll talk a little bit more of that coming up. Okay, then we have to look at the abdominal wall. Okay, obviously we would like this to happen to where we have an intact abdominal wall. All the abdominal organs are present in the abdominal cavity. If the abdominal organs are not all present in the abdominal cavity, then that's called a hernia. Okay, in this particular case, we have, looks like a little bit of the spleen way over here. This is all mesentery with some small bowel loops that are outside of the abdominal cavity. Here's a hunk of spleen that's extending down in here. So this is a traumatic abdominal wall hernia. You know, got hit by a car, kicked by something, something ripped the abdominal wall, and now some of the abdominal content is spilling out outside of the abdominal confines of the abdominal wall. Okay. Again, that's a hernia. Typically, they need to be fixed. Most of the time, it's not an emergency thing. They can wait a day or two. You don't want to wait a month, but you want to fix them as soon as you can get around to doing it. Okay. Another thing in the peritoneal space, we talked about free air in the peritoneal space. We talked about free fluid in the peritoneal space. We talked about surface serosal detail and things that can cause the detail to become poor. And another thing that can happen in the peritoneal space is this little guy. Okay. This is a little mineralized opacity that is well defined, kind of very thin, eggshell like, but well defined mineralized opacity. And you can see it. Where is it on the lateral view? Okay. I always get two views. On the lateral view, it's sitting right here. So it's got a bunch of stuff on top of it, mainly small bowel loops, a little bit of the colon right on top of that thing. This little mineralized guy here is not uncommon to see, especially in cats, but you will see them from time to time in dogs. And it's called a Bates body. I have no idea who Bates is, but they'll be referred to as a Bates body or a cholesterol cyst, or some people will call it mineralization of necrotic fat. Okay. It's a total incidental finding, doesn't cause a damn thing clinically, and you leave it alone. You don't go after it surgically, you just leave it there. And why do I even mention this? Number one, you will see them and you got to know what they are. But the typical scenario that I will see from referring veterinarians is they'll send in this radiograph, and this is a vomiting cat. And they'll look at this thing and they say, oh, he's got a stone in his small bowel. It's probably causing obstruction and causing him to vomit. Okay. Well, again, you always want to get two views. So if I get the second view and I see it out here surrounded by mesenteric fat, can I tell you definitively, is it in the small bowel or is it not in the small bowel, or do we not know? Okay. If I see it on one view and it's definitely, there's no small bowel around it, it's not in the small bowel. Okay. Over here, it's probably superimposing over the small bowel. Okay. Is this guy in the colon? No, the colon's right here. It's lateral to the colon. So it's in the peritoneal space. It doesn't mean a damn thing. Okay, so you don't want to cause that and make that. That's why the cat's vomiting. If you see it somewhere else and it's not in the small bowel, it's a Bates body. What do you do about it? You leave it alone. Okay, and then what? Just a quick thing, and this will lead into our next section that we'll start in a day or two, about radiology versus ultrasound. They are complementary procedures. There's a lot of things that you will see on radiographs that you will not see or are very difficult to appreciate on ultrasound. And the opposite is also true. There are things that you can see on ultrasound that you will never see on radiographs. So it's not one or the other when you're working up a dog and they've got abdominal issues. It's usually one and the other. Okay. So radiographs in general are best for looking at the big picture. You can see the whole abdomen, all in one radiograph or two radiographs, depending on the size of the dog. And you can see the edges of the organs of the liver and the spleen and the kidneys and things like that. So radiographs are better for getting, number one, the overall big picture of the abdomen. And it's much better for looking at the overall size of each abdominal organ and their relation to everything else in the abdomen. So radiographs are really good for looking at the size and the shape of the liver and size and shape of the spleen. Okay. However, radiographs do not tell me anything about what's inside the liver. Okay. A dog could have a relatively big mass inside the liver, and unless it's actually pushing or bulging on the capsular surface of the liver, radiographically, I'm probably never going to see it. Ultrasound is the opposite. Ultrasound's not as good for looking at the size and shape and size of those abdominal organs. It's really good for looking inside the organ. It's really good for looking at the parenchyma of the organ. Okay. Radiographs are best when the animal is fat. Again, radiographically, fat is your friend because it provides more radiographic contrast and makes the picture even prettier. Okay. On the other hand, with ultrasound, fat hinders evaluation, which we'll learn about. Okay. If you try to ultrasound a fat dog, the images aren't anywhere near as pretty if it's unless it's instead of a really thin dog. Okay. The opposite is true with fluid. We already showed you a radiograph where the dog has a bunch of fluid in his peritoneal space and the surface serosal detail was piss poor. And that's because the fluid silhouettes with all of the abdominal organs, which are the same fluid-like opacity. Okay. On the other hand, ultrasound pictures are fantastic and super pretty when the dog has a lot of peritoneal fluid. Okay. So the thing that you have to realize is they are complementary procedures. Both of them tell you information that the other modality doesn't tell you. And a lot of times you will need to do both. Now, when you get off and you go to your teaching hospitals or into practice, unfortunately, a lot of times now, the initial imaging procedure is ordered by an internist or a criticalist or sometimes a surgeon, and they go directly to ultrasound. And by doing that, they're going to miss information that they should have probably shot radiographs first. Okay. So it's typically best and best practice medicine to do both procedures. You want to get radiographs, and then if you need to, you can do an ultrasound. Okay. Okay, so again, quick review of normal anatomy. Now we're going to talk not only about where these organs live, but how do you look at their shape? What's their normal shape? And can you measure them to tell if they're too big, too little, or just right? Okay, so we're going to go through, we'll start in the liver. So again, the liver is now outlined in red. Okay, here's the liver. This is where it's located, cranial abdomen. On the VD view, cranial abdomen right in here. That's approximately where the liver would live. Okay, just cranial, just caudal to the level of the diaphragm. Okay, now what do we look at? The margins of the liver here in a normal dog should taper nicely. Okay, well-defined tapering margins. Okay, and the edge of the liver, the size of the liver should come right out here and go right to the edge of the last of the ribs. So here's the costochondral junction of the last set of ribs, and it should kind of come out right to that area there. Okay, it shouldn't be smaller than that significantly, and it shouldn't be significantly bigger than that. Okay, and then the other thing that we can use in dogs on the lateral view to help us judge the size of the liver, whether it's just right, too big, or too little, is this organ next to it. Okay, and we said this is the stomach. Okay. And in a normal dog and cat, the stomach sits right here, right next to the liver. Well, the stomach, I said, depending on how much food is in it, it can be variable in size. It can be really small, it can be really big, but the stomach typically sits at about this angle with respect to the liver. Okay. And by this angle, I mean a normal stomach axis, which is what we're talking about, the axis where the stomach is oriented. Okay. Typically should be all roughly parallel to the ribs. Okay. Or perpendicular to the spinal column. So somewhere in that perpendicular to kind of parallel to the ribs. That's the normal stomach axis. If the liver starts to become too big, guess what it's going to do? It's going to get bigger and bigger and bigger, and it's going to push on the stomach. It will push the stomach caudally. And now the stomach axis, instead of being right here, is going to be like this. It's going to be pushed really far caudally, and that's because the liver becomes too big and pushes the stomach caudally. Okay, the majority of the push will come down in here because that's where the majority of the liver lives, and it pushes the pyloric region of the stomach right in here caudally. Okay, so in that particular case, we would have caudal deviation of the stomach axis, which goes along with hepatomegaly, which I'll show you an example of. On the other hand, if the liver is too small, then the stomach axis, instead of being parallel to the ribs or perpendicular to the spine, now will be shifted cranially. So this part of the stomach now will be way up here. And now the stomach axis will be cranially deviated. Okay. So you should probably know that you can use the stomach axis to judge the size of the liver or help you judge the size of the liver. If that stomach axis is caudally deviated, that usually correlates with hepatomegaly or an enlarged liver. If the stomach axis is cranially deviated, that usually correlates with microhepatia or a small liver. Okay. Now, do you see the gallbladder? The gallbladder, we know normally anatomically lives somewhere right in here. It's usually in the ventral liver, right in that area, and it's almost always on the right side. So it kind of lives in here on the VD view and lives in here on the lateral view. But again, for the reasons we previously discussed, you're not going to be able to see the normal gallbladder because it silhouettes with the liver around it. Okay. If the gallbladder becomes abnormal and really huge, then sometimes you'll see it bulge down here. If the gallbladder becomes gas filled, you'll see it. If the gallbladder has mineralized stones in it, you will see where the gallbladder is located. But a normal gallbladder, typically you're not going to see. Okay, the spleen. We talked about in a dog, the spleen, typically on the lateral view, you'll see it down in here, but the remainder of the spleen kind of comes up this way, and the spleen kind of sends up a little part of it right up in that area too. That's on the lateral view, that's where the spleen is seen. Most kitty cats, you don't see this part of the spleen on the lateral view, but a lot of times you will see it up here. Okay, on the VD view, we see the spleen here in both dogs and cats. It's usually a triangle in the left cranial lateral abdomen, but the body of the spleen, the remainder of it kind of comes over this way, but we don't see it because it's got all this stuff in the way. Okay. There is no good way to judge splenomegaly on radiographs. It's experience, it's subjective. You look at it, does the spleen, is it still sharply marginated? Does the margins taper normally, or is it big and rounded? Okay, but there is, like the liver, we use the stomach axis, and the liver extends to the edge of the costochondral junction to judge liver size. There is no way to judge spleen size. And the other thing I'll leave with before we take a break is the spleen is one of two organs in the abdomen that has a mind of its own. It can get big, it can get little, and most of the time it doesn't mean anything. Spleens can get congested just from passive congestion. Sometimes they're sequestering red blood cells. Sometimes the spleen get big and it doesn't mean a damn thing. Sometimes the spleen can get little and it doesn't mean a damn thing. What do you think the other organ in the abdomen that can get big and little and doesn't mean a damn thing is? Any ideas? Well, it's something that you might have to address during your break. It's the colon. Okay. So the colon can get huge and full of feces, and it can get little and not have anything in it. And most of the time, neither one of them are pathologic. So the spleen and your colon can get big, it can get little, and a lot of times it doesn't mean anything. And all of you, girls in there, and even the guys in there, don't pretend that you've been sitting in a situation where you're sitting there and 5 minutes you're fine, and 5 minutes later you are about to have blowout diarrhea. Okay, because it happens to everybody from time to time, and it can come on really quickly. Okay, and so sometimes that colon, again, it has a mind of its own, and the colon will control you. Okay, so don't pretend. And so now let's take a break, and if you need to take care of that situation, you can do that. Okay, so I will see you guys in about 10 minutes. So, 11 o'clock your time. Okay,
Thank you.
see you then.